All right, thank you, Mary. So good morning, everyone. Welcome to my senior interior design capstone, mass transit in the midst of a pandemic, the ticket to healthy transportation. Oops, maybe we'll go. There we go, okay. So my name is Emma Canny, a senior interior design student here at RIT. And I would like to give my sincere appreciation to my committee, starting with Mary Golden, NCIDQ, an assistant professor for the interior design undergraduate program at RIT. Next, Suzanne Lefebvre, CID, IIDA, Lead Green Association, an interior designer at Bergman and Associates. And then Gary Jacob, architectural illustrator and assistant professor for 3D digital design for the College of Art and Design at RIT. Thank you so much for your time and dedication to this capstone. It would not be the project that it is today without your help. Oops. So a quick little overview about what we're going to be going over today, starting with the research question and then moving on to the literature review, research agenda, creative agenda, and final conclusions. So the thesis question that is trying to be answered is, how can mass transit environments protect the health and safety of passengers while also benefiting behavioral health? And this is important because public transit has a socioeconomic impact on the community because of its affordability and availability to all users. In addition, many people use public transit to commute and is a way to support essential workers to get to their jobs. And public transit is used in urban environments daily. So it is something that we need to continue to improve on, because in the current pandemic that we live in, public transit is still kind of being overlooked for design, and there are ways that we can create this environment to be less stressful on the user. So for the literature review, I did a lot of research on previous case studies, and there were 5 variables I was focusing on, such as transit's impact on behavioral health, just because transit is a very highly populated, busy, noisy environment. Our behavioral health is impacted due to the stress and the fear we may have navigating through these spaces, which leads into the next variable of wayfinding. How do we know where to go, navigate through the space? Is there information or cues that lead us to our destination? And then in addition, universal design. How can design be created to suit the needs of all users and abilities? COVID-19 and air transmission. How can we reduce the fear of airborne viruses? And then emerging technology that has evolved due to the global pandemic that we currently live in. So some of the key points that I found from my research is stressful reactions occur when crowding violates personal space. Due to COVID, our personal space bubbles have expanded. We have 6 feet for social distancing, so our personal bubbles have grown. And when our personal space is invaded, it can be a very stressful moment. Signage placed at decision points reported an improvement in navigation. So when you have to make a decision, left, right, or straight, having signage that really cues the traveler to where they need to go allows them to feel more comfortable and at ease navigating through these spaces. Universal design principles create accessible transit environments for all users, abilities, and ages. To restore confidence of travelers, there needs to be an address on the feelings of fear, which are related due to the current environment of it being busy, noisy, and then with the new addition of COVID-19. And then transportation's greatest weakness is air quality due to the constant flow of people, doors and windows being opened, and now, especially when we have more of a concern about airborne viruses. So moving on to the research agenda, capstone research was conducted through tools such as online surveys that were giving out through social media platforms, one-on-one interviews by survey respondents that were willing to participate, in addition to one-on-one interviews with people in the design industry, engineering industry, and then also with experts within transportation fields themselves. And then in addition, I conducted observational research in local transportation sites in Rochester, such as the bus station and the train station. So some key takeaways from the survey is 89% of respondents referred to signage within the transit facility, but only 54% of respondents referred to signage within the transit itself. So this leads to the question of how is COVID-19 procedures being regulated between these two environments? Is it more likely that these procedures are noticed and being done in the transit facility because there's more staff, in comparison to the transit itself, where it's more private, you're by yourself, and there's less signage that's, I guess, telling people like, oh, follow these steps, follow these procedures. And then in addition, 70 to 80% of survey respondents had concerns about occupancy, social distancing, cleanliness, and indoor air quality. So these are big concerns that are preventing people from wanting to use public transit, and really created this driving focus for this capstone to find solutions that can ease these nerves and can create a safer environment for travelers. So I had an interview with the Rochester Regional Transit Service, which some of you may know as RTS, or the bus service in Rochester. And they had made adaptations to their station due to COVID-19 that had great results from the travelers' feedback and experiences. So limited seating prevented congestion at the core of the building. So there was more of a flow of traffic rather than a lot of people static, staying in big clusters that kind of create that feeling of a space being really full and can increase people's stress. Traffic flow was modified with labeled entryways and exits. And then there was a lot of implementation of touchless hardware into the program of their space. So really eliminated those high touch points where maybe they wouldn't be as cleaned as often. So really eliminated having to touch a lot of items. And then in addition, contactless ticket fare eliminated that option of going to like the ticket desk and having to interact with staff. You can easily have it on a mobile device. And then abundance of signage related to pandemic measures reassured the travelers that the transit facility was being cleaned and protocols were being followed. I was also fortunate enough to have a one-on-one interview with Evan Dakotas, a mechanical engineer from Bergman in Rochester, New York. And he specialized in retrofitting air handlers and special filtration specifications to buildings since the COVID pandemic. And some considerations to retrofitting your air handler systems to make them more advanced for the current state that we are in with the concern of airborne viruses is MERV 13 filters, HEPA filters, ionizers, UV filtration within the ductwork itself. So these advanced filters capture particles before being re-entered into the space. And something that was also interesting about this topic was when you're thinking about transit, I guess modes of transit, thinking about where the air is being supplied and exhausted is important. So as an example, when you sit in the back of the bus, or like when you sit on a bus, the air gets exhausted to the back. So air is being supplied from the front and being recirculated in the back. So the people who are sitting in the back of the bus get the most unfiltered air. So one thing that could be interesting to see in the future of transit design is like in airplanes, how air is supplied at each passenger. And you can create this circulation of airflow by having the air being supplied and exhausted to each individual traveler, rather having some travelers having fresh, new filtered air and others being left with the unfiltered air prior to being exhausted back into the ductwork to be resupplied. So thinking about that for future developments of transit is quite interesting. So then just a little summary of the findings that I had where transit environments create stressors to our behavioral health. This is pretty well known due to just how busy and unfamiliar these environments are. Interviews from expertise allowed the opportunity to gain knowledge about adaptations to transit environments, and design decisions can be supported by research acknowledging the concerns from interviewed respondents. which then leads to my creative agenda, which is a transit center design guidebook. So I wanted to create this guidebook so it can relate to a variation of transit facilities that can adapt and have new timeless design suggestions that can improve their interior environments to ease the stress of travelers. So I wanted to think about the journey of transit environments. So starting with the check-in zone and ticketing zone, some implementations that can be added to support this environment is body thermal technology that can reduce the stress and the risk of infected or sick people from coming into these spaces, in addition to contactless ticketing and tons of signage, universal graphics that can keep people very well informed of the next steps and where to go next in their travel experience. Then moving on, the waiting zone. It's great to have real-time updates and scheduling so you always know when where your transit may be and the status of the arrival or departure. So you're really up to date on those elements of your travel experience, in addition to having different seating layouts that support social distancing and material differentiation can also navigate wayfinding, lead you to important elements of the transit experience, and so on. And then for vertical circulation, it's really important to think about the flow of traffic. Because this environment is so congested and busy, having a certain flow of traffic for arrivals and departures really eliminates the crossing of paths and creates this constant flow of movement. And then for the boarding zone, having navigational cues to wait in line, occupancy counters prior to entering the transit allows you to have an awareness and a guarantee that you can find a seat within a rail car or an end of the bus, things like that. So like I was saying before, people have the fear of coming in contact with people that are sick or contaminated surfaces. So having ticketing and check-in solutions that are contactless really eliminates that fear. So for a turnstile, there may be the opportunity to have a mask and thermal body temperature detection. So people will know that in this environment, it's regulated that people are wearing masks, everyone is at a appropriate temperature and that they don't have fevers. Or this could be as simple as being able to digitally scan your ticket, your mobile device to be let into the space. For ticketing kiosks, having the digital ticketing and purchasing eliminates contact with staff. So this would be a great supplement to transit environments. If you wanted to use the digital ticketing kiosk, you don't have to wait in line. You can just go up and do it really at ease without having to interact with staff members. And then also having a mobile device check-in and ticketing app can include purchasing, QR codes, a digital ticket for boarding, and you can also include health screen check-ins like we have on campus to promote healthy contactless traveling. So it's also important to have some sense of zoning for important elements of the transit experience. When you're in a space that you have trouble navigating or you're unfamiliar with, having some sort of wayfinding technique that zones out important spaces creates a quick and easy, reaction or can notice that this is something important, I must go to the station. So that could be ticketing, information desks, security, maybe turnstiles. So ways that you can zone out a space to show its importance and kind of cue the traveler easily to these locations are material, color, and pattern differentiation, ceiling soffits and lighting variation, and large signage and indication of what that space may be. And then signage is also important. In these busy spaces, ceiling hung signage is a great use of sharing information. Just because so many people are on the ground, having signage above the head is really easy for anyone to notice in a space that may be busy. So with these signages, you can have information, universal graphics that also can cue the reader and eliminate the language barriers someone may have. Wall signage is also great for people who may need to use Braille or have poor eyesight, so they can get up really close to the signage. And then something supplemental to wall and ceiling signage may be flooring signage, which is kind of, you wouldn't want to use it on your own because there is so much foot traffic, it could easily be missed. But say there's multiple exits, one leads out to Paul Street and the other leads to John Street. Having signage that indicates maybe a sense of direction prior to leaving the facility would be a good way to use floor signage. So universal graphics and wayfinding. So universal graphics, a good example would be bathroom signage, the men and women sign. They're easily recognizable and understood. So incorporating universal graphics really eliminates the risk of a language barrier. So anyone who may not know English very well could use universal graphics to easily understand a space. So they're great for vertical circulation, information, parking, even COVID-19 protocols such as the mask or the social distancing graphic. So incorporating these throughout your signage is a great way to additionally share information in a new way. So going back to vertical circulation, we've talked about it a few times already, but regulating the flow of traffic really eliminates the congestion of people. So having separate circulation for arrival and departing travelers really allows people to have their own space, own flow of traffic. And this can be portrayed through signage, which can cue the traveler to move through the space, and also color and materials. So say arrivals are green and departures are purple. Having different wings and a color coding system can really also show its separation and their separate purposes. So there are some design implementations that can be added to the waiting zone to make the experience a little bit easier for travelers. One would be having kiosks, informational kiosks that can maybe a traveler has a layover or their flight is delayed. Having these kiosks can show restaurants nearby, digital mapping, hospitality stations. All of these things can be quick and easy information just at the touch of a kiosk. In addition, incorporating occupancy counters outside busy environments such as bathrooms are great, because in a time when we are trying to eliminate overpopulating spaces, having these occupancy counters outside of like a bathroom allows a traveler to notice like, oh, this is over occupancy. Let me wait outside, or let me go a little bit farther down and I can find a bathroom that might be available. So that reduces the chance of overpopulating a space. In addition, incorporating real-time updates, real-time scheduling can keep people up to date on their travel status and can leave them more at ease knowing what is going on. The status of their transportation is out of their hands, but having the information for them allows them to have just an added security of what's going on. In addition, number 4 on this diagram talks about how furniture layouts support social distancing, creates the, I guess, the feeling of being in a congested space, having furniture more spread out. And then to complement that, many flooring companies are now creating timeless design patterns that create 6-foot travel distance. So in number 5, how maybe carpet tiles, LVT, with a change of pattern or color, you can cue these walkways that promote social distancing and can navigate travelers to information such as information kiosks, bathrooms, security, things like that. So for the boarding zone, as you can see here, separate vertical circulation is acknowledged through signage and also color differentiation. Arrivals are green, departures are red, with the additional support of universal graphics within the signage, which locate parking, elevators, bathrooms, things like that. And then to supplement these travel experiences, I think it's still great to include your standard static mapping like you would see on a subway wall, just because maybe you have poor connection, you can't use your mobile device. Having these, like the usual signage that we typically see in transit environments, is still great to have in the case that your mobile device is not going to support you at that time. In addition, number 4 shows how materials can cue travelers to wait in lines. And this is not going to be like the stickers that we see on campus for our floor. This is actually incorporating a different color LVT or a tile, carpet, any of that. It's timeless, it's a pattern, but it also has a purpose. And then in addition to having digital signage that gives real-time updates, such as number 5, which shows this train is about to board, really also at a quick glance, a traveler knows what is going on and what is gonna, like if their train is leaving or just arriving. So it keeps them very up to date on the status of their travel experience. So then moving on to the interior of public transit, there's some elements that can be adjusted and added to the interior of a transit vehicle that can really ease the mind of a traveler. Talking about advanced filtration, MERV 13 filters, and ultraviolet radiation within ductwork systems can allow to have advanced filtration methods that can trap and kill airborne viruses before being re-entered into the transit itself. In addition, having occupancy alerts outside of the vehicle allows travelers at ease knowing that, oh, I'm a family of 4, I need 4 seats. There are 4 seats available on this train car. Or maybe I need a handicap spot. I know that rail car 1 doesn't have a one available, but rail car 2 does. So it really eases the mind knowing I have a place to sit in this transit. And then having easy access to sanitation stations, such as right when you enter into the transit, near luggage shelves, outside bathrooms. This guarantees a traveler their own security and reassurance of that their space is clean. They have control of their own space when they have access to sanitation stations. And then, like we have seen already in today's world, we have barriers, separation between passengers. Like I was saying early on in this presentation, our personal space bubbles have expanded. These barriers, yes, prevent the risk of coming in contact with airborne viruses. Say someone sneezes, you have these barriers to protect you, but it also protects your personal space. So I think there's another reason to why we can have these, and with clear materials, it doesn't hinder your travel experience because you're still able to enjoy the scenery outside of the transit windows. So to conclude, some design highlights that were talked about in this presentation were material differentiation, contactless technology, real-time updates and scheduling, and universal graphics and signage. These are timeless design decisions that can transform the transit environment and promote ridership for the future due to eliminating the fear that people may have of the busy transit environments that we experience, and especially due to the fact that we live in a global pandemic. So these are things that are suggested within this guidebook that many transit facilities can implement and try within their facilities to ease the mind of the traveler. So thank you all so much for listening. I really appreciate taking the time to be in here today. I will open the floor now to the examining scholar, Michelle, for questions.
Hi, Emma.
Hi.
Thanks so much. This is fantastic. You know, the notion of people coming together and managing that. Oh, forgive me. We have a kitten that showed up, a stray, and so the stray is now coming into my meeting. So my apologies. You know, we've long been dealing with this notion of handling people en masse, and the struggles therein, right? And so what COVID seems to have done is to highlight all those things that we already knew were an issue. You know, you cited Evans and Evans and Werner's classic work, based on the notions of stress and crowding. That's been the case for quite some time, right? We know that people want distance. We know that people can never find their way, right? We know that universal or inclusive design is an issue, but it seems that COVID has made this just something that we're more aware of, and in fact, I would say more willing to pay for, right? Perhaps that's the most telling change. And so I'm curious, since we've known that many of the issues you've brought up here, which are fantastic, and I do appreciate you helping us improve design for mass transit as a whole. We need guidebooks like this. Where do you see the differentiation? Why now? In other words, it seems to me that all your recommendations are great in general, regardless of COVID. So why now? Why do you think that this is so important because of COVID?
I just think, especially like when COVID first started, a lot of us were afraid to go out in public. And now that our lives are becoming more normal, we're starting to be able to do more things. I think in a way, there are ways that transit can be modified to improve the safety of travelers, because I feel like people are like, oh, like things are getting better, I can go out and travel. But I still think there could be modifications to the travel experience that can make it safer. And the way like subways and things like that, they're still going to be busy and congested, especially people going back to work. And I think there can be modifications that can improve it just for the overall, I guess, mental aspect of feeling more at ease in these environments. And the feeling of being in an unfamiliar space is uncomfortable, and it's not going to go away without modifying the travel experience.
Yeah. No, thank you. I do have one follow-up question, and then I love to defer to my my colleagues here to ask their questions. My second one is related to your point about the sense of safety, right? And you talked about cleanability. I noticed that your recommendations really hinge upon removing the human element. And yet one of the things that that service provides is seeing that the cleaning is happening. And I will say in healthcare, we use that quite a bit, right? That that the cleaning person coming into my room is that cue that someone is paying attention to this. And so I'm curious about, in your solution, where you address feeling like the perception that it is safe from a cleanability perspective, from air, in the absence of course, being able to see air or seeing other people present, because I didn't see you address that sort of service aspect.
Yeah, and this was a conversation I have had with my professor. I think with a little bit more time and research, I think it'd be interesting to think about advanced technology, like maybe when you're leaving a space, a press of a button, there's some sort of cleaning procedure that is done at each individual seat. One thing that I saw within like observational research at the Rochester bus station and the train station, they have signage that would say, oh, this space was cleaned at 2:05 p.m., things like that. I think that could be one thing that could be great, to just at a quick glance, someone can know like, oh, this was cleaned an hour ago, or this section was cleaned 4 hours ago. Maybe I should try to find a different spot to sit. I think with the inclusion of signage related to cleaning procedures would be a simple way to give awareness to the cleanability of the space if advanced technology was something that wasn't incorporated.
Thank you.
Thank you.
Really nice job.
Is it our turn?
Sure, yeah.
I would like to share.
I'm listening. And I know, Emma, this was fantastic. And I think we've been working months with you. So to see this kind of all come together in, 20, 30 minutes is really great, because you're taking all you did a lot of deep focus research. A lot of groups, a lot of interviews, stepping out probably of your comfort zone a bit,
Yeah.
to do a real professional, thorough research to gather all of this. So then you can, find your it was 5 focus areas. So I guess because we've talked a lot about this. What do you think? Well, what was after you developed all of this? And I know we discussed there was a lot of information, and we didn't decide not to go too far into any of, into any one specific, to kind of keep it a bit higher level. But what did you find the greatest interest in, and also what you feel can move the needle a bit more in transit? Because I just came back from my first trip in a year, circulating through all the airports. I didn't see a lot of change at all, except that they've still taken out seating and things of that nature, but they have twice as many people in the airport, so that didn't really work out. But what did you get out of this that you felt you really enjoyed, and it could be two different things, where you think we should be focusing more?
Yeah, so I guess like two things that I actually found really interesting was the universal graphics element. So that was interesting to collaborate with graphic design professors here at RIT, because it was something I'm aware of. Universal design is something we talk about all the time in our program, but thinking about universal graphics that supports universal design was interesting. And then in addition, kind of connecting those two questions is the indoor air quality, air handlers, advanced filtrations. That was extremely interesting. That was definitely more engineering focused to my research, and it was something that was very new and exciting to me. We didn't talk a lot about air handlers in building systems in my courses here at RIT, but it was something that was super interesting. I would have never thought about how air is being supplied and exhausted and the flow of that. And so kind of going back to what Michelle was saying, like, how do we know things are being cleaned? Is our air clean? That is something that if I had more time, I think it'd be something really great to further develop and investigate, just because it's out of my wheelhouse. It's very interesting, it's challenging. And I think it is something that could be really improved in transit facilities, and something that we're not really aware of. So I think that would be great to spread more awareness of it and show that there is improvement and that it's supporting a safe environment.
No, that's fantastic. And I think in our world of interior design, it's also working with where you touched on it, with the best placement. Where is the best placement? And this goes for building design, exhausting out air, we don't want to put that at a sidewalk at all. And it does, and at level and in urban environments. So I think it's great that you're starting to think about it, because it does affect, although we don't see it, how we develop the space around it matters. So great job.
Thank you.
Emma, great job. I have a question, like, what surprised you in this process? What is different from when you set out to do this capstone? Were you surprised to discover in the process of this?
So I think, well, when I first started my survey research, my one-on-one interviews, part of me, like as a traveler myself, I wasn't super concerned about traveling, but hearing from other people their concerns about occupancy and cleanability and indoor air quality, like people were concerned about that, people that aren't in design. And I was very intrigued to see that there are so many travelers out there that have the fear of using transit, especially in the pandemic. And then kind of as like another like side note, just overall with this presentation and this whole project, something, if there's people on the call that aren't senior interior design students, they're a couple years below, your project transforms so much. You do so much research and investigation, and when you make this topic, you have this whole idea of the final outcome, and it completely transforms, because what you investigate and your findings, they really just evolve over time, and you really don't know the final outcome until the very end. And so it's been a really cool and interesting process. This is the biggest research project we've done, so there's been a lot of surprises along the way.
Was there anything you had to throw away, like an idea that you had to get rid of during the process?
I guess like when we would meet here and there throughout the semester, like I always had these big ideas of grand renderings with people being able to move through the space. But it was too focused on a specific transit. With the guidebook, it really created this versatile platform that can share information to all sorts of transit facilities. I really didn't want to focus on one, and having these renders would just create this space that was just very specific to this made up transit facility. So say RTS wanted to modify their station and my design was all about a train station with super realistic renders, they would think, oh, I can't apply this to my space. So creating these diagrams that didn't really specify a specific location really allowed me to create this guidebook that was versatile to any transit facility.
Yeah, your illustrative style throughout this, the graphic style really helps make it not specific to a place that a 3D rendering would make us worry about what, exactly where it was and is it real or not. This was very helpful because it kept me zoomed out thinking about the broader concepts. I'm interested that you had touched upon some air handling stuff during the process, but in your design conclusions, that what air handling was not part of your sort of design, your final bullet points. Is there a reason for that?
No. No, but there is a great importance to that. So it definitely should have been in my conclusion, but it wasn't. Anything else?
Yeah, I have another question. You have 5 or so recommendations, and given your desire to, influence transit, broadly, I'm curious if you could share what you think would be the most important of the 5. And I simply ask because, as you know, design is a matter of trade-offs and choices, and we can't have everything. And so, if you were to pick one fundamental principle, what would that be?
So I actually think the air handler stuff is really important just to be creating a safe indoor environment. But I believe creating wayfinding and signage solutions that can easily share information to all travelers and can easily cue navigation is most important, especially in busy, unfamiliar environments. Having easy cues of navigation and direction, sense of direction, can create a travel experience that is much easier, especially when you are very unfamiliar with the space that you're in. So I would say that having a plan that supports wayfinding and directional knowledge would be probably the biggest factor for me.
That's so interesting because, I was guessing you were going to say universal design. However, when I think about what we know in clinical literature around the experience of the waiting, right? Patients and families who are waiting. I don't know if you know what their number one way to relieve stress. It's access to information.
Mm-hmm.
That's pretty much very nicely shown in all the literature, which is logical, right? And so, to your point, reducing improving one's access to information, or where I should go, what I should do next, as being the sort of fundamental piece to reduce stress is interesting. So, yeah, thank you. Fascinating.
Thank you.
I appreciated that it didn't get too into the weeds of sort of security theater. We see a lot of this, and we saw a lot of this in transit post 9/11, and we could follow the same sort of rabbit holes that we went down and create essentially spaces that look safer, but are only calming us and aren't really safer in a sense. And I appreciate that most of your recommendations, if not all of the recommendations, are real recommendations that aren't about the perception of being safer, but actually helping people, understand where they are and how to move through a space in a safer, manner. I like that.
We still have a few more minutes left. So Michelle or Suzanne or Gary, if you have additional questions, you can continue to post those.
I
Okay,
do have a question. Well, oh, sorry, I do have one more
No.
question.
please go right ahead. We have lots of time.
Just one more, this is an interior design thesis. And interior design, I'm not an interior designer. My doctorate's in architecture and on cognition. So I know I would never claim to be a designer, but working with many of them, it seems to be that what we're really about is the relationship between people. And much of your design requires that people no longer have contact, right? It is about separation. And so I'm curious how you balance, right? The digital, right? That which can happen without connection between people when interior design is all about connecting people, or it seems to me. So I'm just wondering if you have a comment about that. Newly entering the field.
That's a very interesting question. I think so. You're right. Interior design is a lot about the interaction of people, how people use space. But I feel like in travel environments, just because I feel like, especially when you're on a bus or on a train, I feel like you don't really want interaction with people just in general, typically. So I feel like a lot of us, this is more of a private experience rather than a social experience, unless you're with like you have a travel party, basically, of family or friends. So I feel like in this certain case, kind of eliminating the contact with other people is fine, just because just by personal experiences and just coming from feedback from other interviewees about how they don't really want to be around people, it just kind of supports that. But you are right, in general, typically recreate space to bring people together. But in this case, I chose the direction of trying to separate people just to ease those concerns that people have.
Fascinating. Very well said. Thank you.
Thank you.
So Emma, with that, and this is a little different from or hoping you got something out of space modification with this, and we didn't get into that, and we knew that's something that everybody is thinking about and talking about, all the way from easy modifications to what is the future going to look like? Our space is going to get bigger. That's not sustainable. Are people going to be working differently in all of these things? So the vertical circulation portion probably is what you looked at most for spatial separation. But did you think of coming out of this, and it's still an unknown, do you see changes in how future transit centers would be designed? Or do you think it's just simply these smaller incremental things of kiosks or signage, or sometimes the signage and the flooring and materials, they don't always work. Sometimes you need to put it in people's faces, or it's just the human nature just to kind of revert back. So maybe it is space that's the way we design it is really going to help, move it forward. Do you think anything that you've come across would have to modify, in the waiting area from your journey, that first slide? Do you see any future modifications in transit centers?
Yeah, I personally think the whole ticketing and entering the transit facility could change, just due to maybe the implementation of having this extra check-in point for health screens or a temperature check, Right now, it's just typically like people standing with like a thermometer or something like that. But I feel like the built environment can now maybe include this extra check-in point that just adds extra security for the travelers. And then like we were saying before, say it was a brand new transit facility, creating some sense of flow of traffic that really separates arrivals and departures, I think would also be something that would have to change. But I feel like those two elements of the transit experience I find to be more of a spatial modification than like the waiting zone and the boarding zone.
Thanks. Because essentially this guidebook is kind of like you utilize it then to decide, how you want to either modify a space or how you want to build a new space as well. And that was the goal I for this. So it's great.
Do you think that the principles that if you believe that we are all in transition really at all times, right? Do you believe that that this kind of guidebook would be useful in other scenarios? I mean, is a city not a mini center of mass transit is not the same thing of an indoor shopping mall or of a school. So I'm curious where you might see some of these principles being applied more broadly.
Yeah, I do think that these principles can be used in other settings, especially when it comes to air filtration and wayfinding and universal design. I think that these elements are very supportive in any interior environment, public interior environment, that can really just create this easier, well understood experience in an unknown environment. So I really do think that this guidebook could be used in other like commercial settings. Doesn't have to be limited to transit. The graphics relate more to transit, but I think the actual variables could definitely be used in many different public spaces.
I love that you've got me thinking in this whole process about where we congregate because we have to and where we congregate because we want to, and how that affects us, our design of spaces post-COVID, right? So a lot of these spaces are places we congregate. Here in this guidebook are places we congregate because we have to. We just like have to get through these spaces. But how that translates to those spaces where we're willingly getting together is a really cool notion, and I'm leaving with that new idea. Thank you very much for that.
You just made me think about something, Gary, is the social aspect. We're talking about to get to point A to point B or Z to get to somewhere else. But in larger urban environments, there's a social aspect of waiting. So there's the whole commercial side of it in restaurants, shopping, even in train stations, Grand Central. I mean, there is an aspect of people coming together. So that would be interesting also to how does that look in tying in the commercial part, because then there's the whole money aspect of this, getting profiting, having retail environments, making a transit center desirable so people use the system. So I started thinking about that when Gary was talking about the social aspect, but I know that wasn't part of this, but did it ever come across, or did you ever think about all those in between third, fifth spaces, so to speak?
I didn't really think about those in between spaces, definitely more focused on those big four factors of the travel experience: ticketing, waiting, circulation, and the boarding zone. But I definitely think like continuing this project further, those additional zones I think could also be something to consider.
Think about the airport Starbucks and Cinnabons. Like,
Yeah.
what are they going to do?
I think it's just because I was just there a few days ago. It was, yeah, it's all still there. It's not, it hasn't gone anywhere.
Okay, any remaining comments or questions? All right, well, congratulations, Emma, on completing your capstone. And at this time, I would like to extend a sincere thank you on behalf of RIT's Interior Design Program to Michelle Osman and to our committee members, Suzanne and Gary, for their valuable feedback. We are indebted to you for your thoughtful cross-examination of our students' work. I would also like to recognize and thank our moderator, Adriana, for helping behind the scenes. And we would like to thank you, especially our audience, for your attention and support, both online and here in the gallery. The committee and the examining scholar will now enter the breakout room for deliberations, and this completes the final oral defense for Emma Canny. If you are online with us, you are welcome to stay on for the next presentation. Thank you all for attending and have a wonderful day.